Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel Health Education. From today, we are starting our discussion on benign prostate hypertrophy. This discussion will have two sessions. Today, we shall have first session of our discussion on overview of benign prostate hypertrophy. Are you waking up multiple times at night to urinate? Are spending more time in the bathroom than ever before? It can be more than just aging. Let's talk about benign prostatic hypertrophy. Do you know that over 50% of men over 50 suffer from benign prostatic hypertrophy? The good news is it's manageable. I shall mention my patient, Mr. Shahjahan, a 60-year-old who thought frequent bathroom trips were just part of aging and he getting older. Little did he know, he was dealing with benign prostatic hypertrophy, a condition that affects millions of men worldwide. If this sounds familiar, don't worry. Today, we shall break down what BPH is, its symptoms, and how to manage it effectively. In today's video, we shall explore why BPH happens, its common signs like urinary urgency and weak flow, and the available treatments, from lifestyle changes to advanced medical options. I would like to share with you 3 case histories of benign prostatic hypertrophy, which emphasize the symptoms, challenges, and treatment options for benign prostatic hypertrophy. First case history, the 90s struggles, Mr. Ijaz frequent urges. It's a case history of Mr. Ijaz, a 62-year-old retired police officer. He noticed that he was waking up 3 to 4 times every night to urinate. Initially, he thought it was just a part of aging. But the disturbed sleep started affecting his mood and energy levels. After consulting his doctor, he was diagnosed with benign prostatic hypertrophy and started on medications. Today, he sleeps peacefully and feels like himself again. Mr. Ijaz's case history highlights nocturia, that is the frequent nighttime urination, is a key symptom of BPH and emphasizes the importance of seeking medical advice early. I suggest that don't let frequent bathroom trips ruin your sleep or your life. Get checked. It could be benign prostatic hypertrophy. The second case history, the embarrassing delay, Mr. Khan's weak stream. This is a case history of Mr. Khan, a 55-year-old businessman. Noticed that his urine flow had become slow and weak. It took him longer to empty his bladder, and he often felt like he still needed to go. The final straw was an embarrassing moment during a long flight when he couldn't urinate despite feeling the urge. A visit to the urologist confirmed an enlarged prostate. After a minimally invasive procedure, he's back to living confidently. Mr. Khan's case history highlights that weak stream and incomplete bladder emptying are symptoms of benign prostatic hypertrophy. And the benefits of modern treatments like TURP are laser therapies. Remember, a weak urine flow is not just an inconvenience. It's a sign your prostate might need attention. The third case history, the health scare, Mr. Parvez's sudden urinary retention. It's a case history of Mr. Parvez, a 70-year-old grandfather suddenly found himself unable to urinate one evening, leaving him in a severe discomfort. At the hospital, a catheter was inserted to relieve his bladder, and further tests revealed severe BPH. Thankfully, with medications and lifestyle adjustments, he avoided surgery and is now managing his condition well. Mr. Parvez's case history highlights that acute urinary retention is a serious complication of untreated benign prostatic hypertrophy and the importance of regular checkups for older men. Remember, ignoring BPH can lead to serious complications. Don't wait until it's an emergency. Seek help early. Do you or someone you know have similar symptoms? It might be time to talk to your doctor. So I end here. Tomorrow, we shall have our discussion on what the benign prostatic hypertrophy is, what are its symptoms, how it is diagnosed, and how it can be treated. Till tomorrow, take care. Khuda Hafiz.